The last speaker for the day as well as the CME is again person from the second list, Dr. Sitaram, and Vinay, please introduce the chairpersons.
Thank you, sir. In the last but not the least, the topic for our session is mentor and mentee. To chair this session, I would like to call upon our chairperson, Dr. Ramesh Ruprai sir. Ruprai sir has served in SMS Medical College and Hospital for nearly about 30 years and was head of the Department of Gastroenterology for more than 15 years. Sir has been the past president of ISG since in 2007 to 2008, and as member editorial board of World Journal of Gastroenterology. He is presently as a chairman of Ethical Committee of Rajasthan University of Health Sciences and member of Specialty Board of National Board of Examination. We have the esteemed chairperson to chair the session, Dr. V.A. Saraswat sir. Saraswat sir has served at SGPJ Lucknow for more than 3 decades as a head of the Department of Gastroenterology. He is currently working as a professor and head of the Department of Hepatology and the Pancreatobiliary Sciences at MGMCH Jaipur. He has been the president of ISG and INSL and is presently associated with the editor of IJG and JCEH. Welcome, sir.
Good evening. We are at the concluding session of Jaipur Surgical Festival. It has been a great academic feast for all of us, but this session is ice on the cake because this session is dedicated to our Guru Shishya Parampara. The topic for this session is mentors and mentees. To dwell on this important subject, we have legendary teacher, none other than Dr. V. Sitaram from Vellore, who has been himself a mentor for last 37 years. Dr. V. Sitaram did his MBBS and MS General Surgery from Vellore CMC Vellore, and he joined in 1984 the Department of General Surgery. And after that, he has trained himself in various important subspecialties. He trained himself and obtained FRCS in 1990 from UK, got special training in liver transplantation from UK and Hong Kong. He is a prolific teacher and par excellent teacher, and he is going to talk to us with the role of mentors and their relationship with the mentees. Dr. V. Sitaram, please.
Thank you, sir. Can I share my screen, please?
You want to make a live presentation, or you want us to play the video? Choice is yours.
I'll make a live presentation. I'll take a leap of faith in BSNL and make a live presentation.
Thank you. Thank you.
You can see my screen?
Yes, we can.
Yes, please.
Respected chairpersons, ladies and gentlemen, especially my young colleagues in the audience, training to be surgeons and young surgeons. I thank Professor Vinay Kapoor and his team for giving me the privilege of this virtual podium today. His instruction to me was that I should give a philosophical talk, and this is a topic that I've chosen. There is a tradition in CMC Vellore that teaching faculty who retire have the opportunity to address the undergraduate students and the medical faculty one last time. This talk borrows a lot from what I said when I retired in 2014. I grew up in a middle-class family in a Tier 2 city in Tamil Nadu. My parents tried to teach me that hard work, integrity, doing the right thing because it is the correct thing to do were important. They also taught me, strangely, that money was not the most important thing in one's life. I will start with a small story. My sister has 2 sons, and when they were small, she used to harass them about their studies. My sister was extraordinarily bright and had stood first throughout school and college. She made a conscious decision to become a homemaker. So she used to ask her elder son, Chandru, when you grow up, you will have children. Don't you want to tell them that you were first throughout school? So one day, my nephew Chandru asked her, Amma, how many students were there in your class? My sister said 40. And you came first? She said, yes. The other 39 who did not come first, no, they will also have children. I'll be like one of them. I was like one of those other 39 children in school and college. So that gives you some idea of what I was when I was young. Becoming a surgeon does not just happen. You don't drop down from the sky. A surgeon is created, shaped, molded. You must have role models, heroes you can look up to. I want to share with trainee surgeons and young surgeons ways in which my heroes, my role models, influenced me in a positive way. They mentored me. Sometimes they tormented me. Dr. Bhatt, or HSB, as he was popularly known, was my father-in-law. It was strange to be related like this to an iconic figure, a surgeon, the father of the specialty of urology in India, a man who had taught many of my teachers. I suspect I made a hash of the relationship. There are many, many stories about HSB. He was the last word as far as patient care was concerned. I have personally accompanied him on 4 full ward rounds on an ordinary day. In addition, there would be at least 2 phone calls, 11 p.m. and 5 a.m. to see how his patients were doing. He knew virtually everything about every one of his patients, and treatment plans were fine-tuned to suit each patient. There were no generalizations. During ward rounds, each patient was made to feel that HSB has got out of bed that morning only to see him or her. I told you there were many stories. I will tell you one. There was a patient in the urology ward who needed an operation, but HSB did not put him on the list. He missed 2 consecutive operating days like this, and then HSB had to leave town. Before he left, he told his team not to operate on this patient. His team thought they knew better. Teams generally think they know better than the boss. Operated on him, and 2 days later, patient died. When HSB returned, he inquired about this patient and was very upset with what had happened. A week later, one of the trainees plucked up enough courage and asked him, "Sir, why did you tell us not to operate on that man?" HSB said, his palms and soles, they were soft. He was an agricultural laborer, but had soft palms and soles. It did not fit in. I had not figured him out. This was an important lesson. When things don't fit in, pause. Don't jump in to operate. Dr. Desmond was known as a freak ENT surgeon. He could do things that nobody else could. Those days, university exams for CMC Vellore students were conducted in Chennai, and ENT postgraduates from Vellore would regularly get into trouble because they would talk about what they had seen Dr. Desmond do in theatre. Impossible would be the retort from examiners from other centers. Mortality was very high in exams those days. When Dr. Desmond retired, Men's Hostel gave him a farewell. I was a student then, and I vividly remember what he said. He said, "I have been called a freak, but I want to tell all of you, I am not a freak. I was sent for training to the United States. Every weekend, when all my colleagues were partying, I did stapedectomies on the cadavers in the anatomy department and in the mortuary. In 2 years, I did thousands of stapedectomies. I am not a freak. I have got where I am by working really, really hard. Boy, what an important lesson in life. Dr. Fenn was a charismatic teacher, and even today I remember things he had taught us during bedside clinics. He was a very generous man. He would admit patients from his OPD, and all that you would see on the OP chart would be one word, admit. But he would have taken a careful history and done a thorough physical examination. As a registrar in the ward, if you found something in the history that Dr. Fenn had missed, or elicited one extra physical finding, he would be thrilled. His day was made, so naturally so was yours. Afterwards, when he sat down to make the scrub list for the next day's operating, you could be sure that all the choice bits would come your way. I learned that a good teacher is not threatened by a student, but rejoices when the student does well. Dr. Major was a Welsh dragon. She was chief of anesthesia. She was my first boss after I finished internship. It was my first exposure to the importance of having a checklist for almost every situation and adhering to it meticulously. She had a terrific sense of humor and defined an operation as the only interruption in an otherwise smooth anesthetic. During my year in anesthesia, I had the privilege of watching our neurosurgery chief, Dr. Matai, operating. He was an inspiration to watch. He would operate for 10, 12, 14, 16 hours at a stretch. He would operate in exactly the same way during the first hour, the 6th hour, and the 16th hour. There would be no change. He would be absolutely meticulous, unhurried, and brilliant. I told myself that if I ever got a chance to become a surgeon, I would be like that. From anesthesia, I moved to anatomy, and this was perhaps the best year of my life. I was recently married, not a care in the world, life was good. Dr. Mary Jacob was an interesting person to work for. Everyone said that she was a difficult boss. She taught me many things like English, precision, and discipline. Let me explain. Correcting an answer paper meant that you underlined all the things that were wrong and wrote the correct answers above. Evaluating a paper meant that you read the paper and gave a grade based on a template of what was expected of the student. Teaching meant that you guided the student towards the answer to their question. You never answered the question directly. Mark lists had to be on her table within 14 days after completion of any test. I remember I was going on a holiday after completing a test and would have missed the 14-day deadline. When I went to ask her about it, she said, "Sitaram, I am sure you can count up to 14. I stayed up all night, finished the correction, not the evaluation, the correction, left the mark list on her table, and then went on holiday. During term time, you could take leave only if you dropped dead unexpectedly. Boy, was she tough. During the first 3 months in anatomy, she drilled the principles of anatomical thinking and anatomical language into our heads. She did it again if you went back there as a demonstrator. Like for instance, below was not deep 2, it was inferior. Above was not superficial 2, it was superior. I have seen a whole generation of medical students who think that below is synonymous with deep 2. Sir Ian Todd was one of the granddaddies of colorectal surgery. He spent 3 months in our department in 1981-82 when I was a registrar. While demonstrating an abdominoperineal excision of the rectum, he went into the urinary bladder. This is one of those unforgivable sins. As per protocol, a urologist was called. And when he walked in, he said, "Oh, it happens, Mr. Todd." Sir Ian froze him with a look and said, "No, it does not happen." That day is still etched in my memory. What I learned was that it is very important to have a "no, it does not happen" attitude. Too often we say, "Oh, it happens," and we move on. Far too often. Dr. Philip Kurla was a top-notch plastic and microvascular surgeon. He taught me basic surgical techniques, which I still cherish. The concept of the relationship of the needle with the needle holder with the hand, the position of the hand and the elbow while taking a suture, the position of the needle with respect to the tissue, it should be perpendicular in all planes to the tissue. Instrument ties, squaring up a knot, reef knots, all these are still vivid in my mind. He would talk about the waist of a knot and add an interesting comment about your girlfriend's waist, a man with flair and panache. Dr. Bhushanam played a major role in my training. I passed MS and joined his unit. And during the first 2 months, he rounded off my surgical training very well by taking me through all the standard major operations in general surgery, like radical neck dissection, parotidectomy, gastrectomy, colectomy, all that we had done as trainee registrars, but this rounding off process was very good. He would teach a lot of small things not found in the operative surgery textbooks, which made a significant difference. He taught me other things as well. One conversation with him went like this. "Sitaram, you're going on holiday?" "Yes, sir. Going to Bangalore from 14th to 19th, Tuesday to Saturday. I'll be back on Sunday in the evening, sir." "Going by train?" "Yes, sir." "Booked your tickets?" "Yes, sir." "Dr. Bhatt picking you up at the station?" "Yes, sir." By now, I knew I was in trouble, but I couldn't figure out where this conversation was heading. "Your return ticket sorted out?" "Yes, sir. HSB has booked our return." "So you have remembered to do so many things, but haven't remembered to apply for leave in the leave book. How is that?" The Sudarshanams were very special to an entire generation of medical students. They were our professors of pathology. Their home was open to us 24/7, 365 days a year. I realize now that they must have had something to do with the movie Inception, because when we went to discuss problems with them, we came away with solutions. All the while, we would be thinking that we had arrived at the solutions. The Sudarshanams taught me 2 important lessons. The lessons are so important that they merit 2 separate slides. Lesson number 1. Sitaram, remember from now onwards, everything that you have will be thanks to somebody else's misery. Your food, your car, your holiday, everything. You will have it because somebody is sick, in hospital, and is miserable. Lesson number 2. You will have periods in your life when you are really low. The only way to pull yourself out is to do something for somebody else without getting anything in return. You are lucky because you are a doctor and a teacher. All you have to do is to do an extra special operation or take an extra special class. Dr. Yogesh Pai was an alumnus of CMC, orthopedic surgeon in Middlesbrough, UK. I'll tell you a story. One day, a tall, good-looking but scruffy young man was waiting to see Mr. Pai in his office. He was from the northernmost part of Pakistan, bordering Afghanistan. He had passed the PLAB exam, and someone in London had told him, "You go to Middlesbrough. There's an orthopedic surgeon called Yogesh Pai there. He will help you pass the FRCS Part 1. Mr. Pai used to take classes in the evening on anatomy, physiology, biochemistry, pathology, microbiology. At the end of the class, he would drop them off where they were staying. If they were hungry, he would buy them a meal. If they needed cash, he would give them some. remarkable man. This is the ultimate example that a surgeon should never forget the scientific foundations of surgery. Also, it is far more important to be a good human being than to be a great surgeon. He was my guardian angel during 1988-1991, and I benefited a lot from his wisdom. Professor Paul McMaster was professor of surgery at Birmingham and is one of the pioneers in liver transplantation. He told me that he moved to Birmingham after training in Cambridge with the intention of setting up liver transplantation. He said, how foolish I was then. I thought if I had a little more space, a little more equipment, a little more money, I could set up a liver transplant program. Big mistake. Invest in people, he said. They are far more important than space, equipment, or money. If you have the right people, the rest will fall into place. Without the people, nothing will happen. Human resource is more important than land, buildings, equipment, or money. When he retired, Birmingham could boast of having one of the best liver transplant centers in the world. Professor Fan was professor of surgery in Hong Kong. He would do a 100-kilometer charity walk, shower, change, and come in for a 15-hour live donor liver transplant. This underlines the importance of fitness in a surgeon's life. At the end of a 15-hour day, he would spend 2 hours getting meticulous hemostasis. It was amazing to watch him operate. Dr. Shrikande is a senior surgeon in Mumbai. Many of you will know his son, Shailesh. I learned 3 important lessons from Dr. Shrikande. Remember, my friends, books don't bleed. His words still echo in my ears. He passionately believed in the sequence of history, physical examination, tests, and then plan of management. He used to say, when the technology curve increases, the learning curve decreases. Another one of his pearls was, if the treatment does not work, don't change the treatment. Review your diagnosis. I reached where I am today as a surgeon thanks to Dr. Kanduri. He has been a teacher, mentor, friend, philosopher, and guide, all rolled into one. I remember an event in 1984. I had passed MS and I joined as junior lecturer in the department. 2 surgeons were doing an interposition mesocable shunt. They called Dr. Muralidharan from thoracic surgery to help with the anastomosis. I was talking to Dr. Muralidharan while he was scrubbing, and he said, only Prakash Kanduri has the skill and patience to dissect out all the fine tributaries of the superior mesenteric vein, ligate and divide them. I mentally told myself, I will be like that one day. Dr. Kanduri was a brilliant surgeon. His philosophy was, a good operation is the best post-operative care. When he scrubbed out after finishing an operation, you could be sure that the best possible job had been done. There were no compromises on technique, ever. He intensely disliked morbidity and mortality. If you had done an operation and on the next day's rounds, there were more than 10 mils of blood in the drain, he would just shake his head. The bar was set very high right from day one. He would see his patients again and again and yet again, every day. He taught me that seeing your successes serves only to boost your ego. True character would be to see your disasters, your complications, at least twice a day, if not more. Remember Sir Ian P. Todd? With Dr. Kanduri, it was a no, it does not happen attitude all the time. He was generous to a fault. He taught me everything that he knew and would never hold back anything to make himself extra special. If one of us had made an important contribution in a patient's care, he would give us due credit in public. And this generosity was not restricted to surgery alone. Even today, he will not allow me to pay for a cup of coffee or a meal. Dr. Kanduri's dream was liver transplantation. At the age of 55, he went to the US for a year, worked like a resident at his own expense, came back and set up a liver transplant program. We say you cannot teach an old dog new tricks. He proved that you become an old dog only when you stop learning new tricks. Do I have any advice for you? Of course I have. Which old man doesn't have any advice around with them? First and foremost, and most important, look after your physical health. Remember Professor Fan. Health could also be spiritual health, mental health, financial health. All are important, but physical health is very important. But that's a talk, another talk altogether. During my lifetime as a surgeon, I've lived through two exciting developments in surgery. The first was laparoscopic surgery, and the second was liver transplantation. May you live in interesting times. Thank you very much, and thank you, Dr. Kapoor, for inviting me. Thank you.
Thank you. Thank you very much, Dr. Sitaram. I think it was a wonderful listening experience to see how you've summarized your journey and your training as messages from your mentors. Well, mentors also need mentees who are as perceptive and as imitating a sponge in terms of absorbing messages and distilling them for their own mentees. I think I would look at this whole half-an-hour experience as an excellent teaching curve, learning curve, telling mentees very indirectly what they have to pick up and learn by giving the instances that you have given, and has been a fascinating experience.
You're very kind, sir.
One quick question I would have to you. Now we are in the 21st century, 2 decades into the 3rd decade of the 21st century. How do you think in the last 5 or 10 years, in the last decade or so, has the approach and attitude of students and mentees, has it remained the same as you've experienced in your earlier years of your long career, or do you perceive any change? Particularly now, I mean, mentors and the mentor-mentee relationship is no longer the one-to-one guru-shishya relationship that we are so familiar with. Departments have grown, trainees have increased in numbers. Departments have 6, 8, 10 trainees, DMMCH people in one batch. So how do you think in these new times have things changed, and how should the old feeling and the relationship between the mentor and the mentee that you spoke about so lucidly, how can it be preserved or worked upon? Your thoughts, please.
Like the Bhagavad Gita says, change is inevitable. We cannot reconcile that. We have to reconcile that. Change has to happen. But some values are indestructible. Values that were true 7,000 years ago, values that are true in 2021, and values that will be true 7,000 years from now. Values like integrity, values like hard work, values like respect for people around you. These are values which are indestructible. I keep saying to my children as well as to my department when I used to work, that your students and your children will absorb all your bad qualities. They will home in on your bad qualities. You will do 100 things right. The 101st thing that you do wrong, they will latch on to that and say, this is what I saw Sitaram doing. So it places a big responsibility on teachers, on seniors, to do the correct thing at every stage in life, because we never know who is watching, and somebody is watching. One of your trainees is definitely watching. Have I answered your question? I hope I have.
Yes, indeed. Professor Ramesh Rupra, I'm sure you'll have some comments and queries.
Not comment, but again, I must appreciate the way you have done the the praise for Dr. V. Sitaraman's talk. I am really thrilled the way he is telling us that how we can learn from our mentors. He has to absorb everything, what his teacher is doing. But in today's era, what I have also been personally watching, that there is change in the attitude of our mentees and the mentors also. So the pyramid is changing. You, as you just mentioned, examination to the
Right. One quick response from you, Professor Sitaram. What are your thoughts on this new trend of what I would say is Eklavya kind of training? The mentors have become distant figures on Zoom, on distant learning. I think this meeting has been a splendid example of some of the best teachers in the world coming together on a virtual platform, and obviously for a short-term interaction. It's not training a person over a 3-year or a 2-year period, the way we conventionally understand mentorship. So what do you think is the place and the future for this approach? Because there must be hundreds. I think Professor Kapoor told us over 800 people had registered and many of them have been listening in. What do you think is the learning and about the quality of learning and mentoring that is happening virtually these days?
You asked about change, and I said change is inevitable and change is happening. Today's younger generation, the trainee surgeon of today, is not influenced by one person or a small group of person in the department anymore. There is a world of the YouTube, for instance. There is a whole digital world which he has at his disposal. And he is picking up so many things from so many sources. A fact that needed maybe 4 or 5 hours to verify 20 years back, 30 years back, today can be verified in 4 or 5 seconds. So the world has changed. The world has changed a lot, and everybody changes. Everybody changes with the times. The mentors change, mentees also change. But some values are indestructible. That all of us have to understand.
Thank you very much, Dr. Sitaram. Thank you for giving us all these, the mentors and the teachers, all these wonderful messages. And the bottom line of core values of learning and teaching are something that all of us should try and emulate, whatever position we are in. Thank you very much for a great talk. Thank you, and I'll hand over to the examiner, to the organizers.
Thank you.
Thank you very much, Sitaram sir. I must say that I have certain एक line है हिंदी में, गुरु गोविंद देऊ खड़े काके लागू पाओ बलियारी गुरु आपने गोविंद दियो मिलाए. I think this line already explained the importance of mentor in our day-to-day life, everybody's life. And being as a surgeon, I don't think so that with changing of time, mentorship can be changed. So sir, thank you very much. I must say that you have elaborated the importance of mentor and mentee in your lecture. On behalf of Department of Surgical Gastroenterology and HPB Surgery, Mahatma Gandhi Medical College and Hospital, I would like to thank all the esteemed faculty members and chairpersons who has spared their time from their tight schedule to be a part of this first Jaipur Surgical Festival, and for making it successful, and of course for delivering pearls of wisdom on a very interesting topic, cholecystectomy, which is going to be very beneficial for the postgraduate surgical students as well as for the young faculty members. I would like to pay my sincere gratitude to our mentor, Dr. VK Kapoor sir, for organizing such a wonderful feast, and I hope many more to come in upcoming years. I want to thank our entire organizing committee for their efforts and hard work. As rightly said, that every end is a new beginning. With this remark, hoping to see you all on 2nd to 4th of December 2022 in our upcoming 2nd Jaipur Surgical Festival. Goodbye, bye-bye, happy and safe journey. Thank you very much.